Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Let us begin with a clear instruction. Do not think of red meat as a free pass, and do not think of hypertension as only a salt problem. Think deeper. Think in patterns. Think in substitutions. Think in portions. Think in preparation. Hypertension is not simply pressure in the arteries. It is a daily mechanical load on the heart, the brain, the kidneys, and the inner lining of the blood vessels. Why does that matter? Because every meal either adds friction to that system or helps calm it down. Every plate sends a message to the arteries: tighten, retain fluid, inflame, and stiffen, or relax, release sodium, nourish muscle, and stabilize energy. Now ask the question directly: how can red meat, a food often blamed in cardiovascular conversations, have a beneficial role in hypertension? The answer is not eat more burgers. The answer is use lean, unprocessed red meat with precision inside a blood pressure lowering dietary pattern. Choose the cut carefully, control the portion, remove the processed forms, pair it with vegetables, legumes, whole grains, low-fat dairy, fruit, nuts, and unsalted seasonings. Do that, and red meat changes category. It stops being a symbol of excess and becomes a structured protein tool. The strongest foundation remains the DASH eating pattern. In the original DASH trial, a diet rich in fruits, vegetables, and low-fat dairy with reduced saturated and total fat lowered blood pressure substantially. Among participants with hypertension, the reduction was about 11.4 mm Hg systolic and 5.5 mm Hg diastolic compared with the control diet. That is not a cosmetic change. In blood pressure medicine, that size of reduction can matter clinically. So, listen carefully. Red meat is not the whole treatment. It is the disciplined ingredient. Use it correctly, and it may help people follow the larger plan with more satisfaction, better protein adequacy, and less dependence on salty processed foods. First, separate the imposter from the real candidate. Do this before anything else. Processed meat is not the same conversation as lean, unprocessed red meat. Bacon, sausage, salami, hot dogs, deli meats, jerky, and many cured meats often carry high sodium, preservatives, and saturated fat. Why is that dangerous in hypertension? Because sodium pulls water into the circulation, increases blood volume, and can raise pressure against the arterial wall. The American Heart Association advises choosing lean and unprocessed meats if someone eats meat, using healthy portions and minimizing processed meats such as bacon, ham, salami, sausages, hot dogs, and jerky. So command number 1 is simple: remove the processed meat first. Do not negotiate with it. If the meat is smoked, cured, heavily salted, or packaged as a convenience food, treat it as a blood pressure liability. Now ask, what should replace it? Choose lean beef, lean pork, bison, or lamb cuts with visible fat trimmed. Look for words like round, loin, and sirloin. Keep the portion around 3 ounces cooked, about the size of a deck of cards. Do not build the plate around meat. Build the plate around vegetables, beans, whole grains, fruit, and low-fat dairy. Then let lean red meat occupy a measured place. Why can this help? Because adherence matters. A perfect dietary plan that a person abandons in 2 weeks is not powerful. A structured plan that includes familiar, satisfying foods in controlled amounts may last. And hypertension management is not a weekend project. It is a repeated daily pattern. Now go deeper. How does lean red meat fit biologically? First, protein. Lean red meat provides complete protein, the essential amino acids needed for muscle maintenance, repair, and metabolic stability. Why does that matter for blood pressure? Because muscle is not just for movement. It is a major glucose-handling tissue and a metabolic reservoir. When people improve protein quality and reduce refined carbohydrates or salty processed foods, appetite control often becomes easier. Less hunger can mean fewer late-night snacks, fewer ultra-processed meals, and better weight control. Weight matters in hypertension, but do not oversimplify it. Say this instead. Reducing excess body weight reduces vascular workload, improves insulin sensitivity, and can lower sympathetic nervous system activation. In other words, the body stops acting as if it is under constant internal alarm. The OmniHeart feeding study gives an important clue. In adults with prehypertension or hypertension, all 3 heart-healthy diets reduced systolic blood pressure, but the diet higher in protein lowered systolic pressure more than the carbohydrate-rich DASH-like diet, even while weight was kept stable. This tells us something subtle. The macronutrient structure of a heart-healthy diet can influence pressure beyond weight loss alone. So ask the audience, why should protein be ignored if the evidence suggests it can support blood pressure improvement inside the right pattern? It should not be ignored. It should be managed. Second, consider sodium displacement. This is one of the most useful ideas for daily life. The danger is not only what red meat contains, it is what it replaces. If a person replaces sausage biscuits, pepperoni pizza, fast food burgers, salty deli sandwiches, and packaged frozen meals with a small serving of grilled lean beef or pork tenderloin seasoned with garlic, herbs, lemon, vinegar, pepper, paprika, rosemary, or chili, what happens? Sodium drops. Food quality rises. Protein remains satisfying. The American Heart Association notes that Americans consume more than 3,300 milligrams of sodium daily on average, recommends no more than 2,300 milligrams daily, and identifies 1,500 milligrams as an ideal goal for most adults. It also notes that cutting back by 1,000 milligrams per day can improve blood pressure and heart health. So do this. Read labels. Count sodium. Do not guess. If the meat comes pre-seasoned, injected with broth, cured, smoked, or packaged with a sauce, be suspicious. The artery does not care how healthy the front label sounds, it responds to the chemistry. Third, use potassium and minerals intelligently. Hypertension is not only about lowering sodium, it is also about improving the sodium to potassium environment. Potassium helps the body excrete sodium in urine and helps ease tension in blood vessel walls. The American Heart Association recommends 3,500 to 5,000 milligrams of potassium daily from food for people trying to prevent or treat high blood pressure unless kidney disease or certain medications make that unsafe. Now here is the key. Red meat is not the potassium hero. Vegetables, beans, potatoes, fruit, yogurt, and greens carry that role. So how should red meat be used? Pair it. Put lean steak strips over a large spinach and bean salad. Add sirloin to a bowl with lentils, roasted sweet potato, tomatoes, and olive oil. Serve pork tenderloin beside squash, beans, and low-fat yogurt sauce. Let the plants do the potassium work while the meat provides protein, iron, zinc, vitamin B12, selenium, and satiety. Fourth, understand the vascular evidence. This is where the conversation becomes more interesting. In the Boldy study, researchers tested DASH-like diets with different amounts of lean beef. One version included 113 grams of lean beef per day, and another included 153 grams per day with higher protein. The higher protein lean beef DASH-like diet decreased systolic blood pressure compared with a healthy American diet, and the study concluded that a moderate protein DASH-like diet, including lean beef, decreased systolic blood pressure in normotensive individuals. What should we learn from that? Not that everyone should eat large steaks. Learn the principle. Lean beef did not cancel the vascular benefits of a high-quality dietary pattern. The pattern controlled the context. The leanness controlled the fat load. The absence of processing controlled the sodium problem. Another controlled feeding trial examined a Mediterranean-style pattern with about 500 grams per week of lean, unprocessed red meat compared with about 200 grams per week. Blood pressure parameters improved with both versions, independent of the red meat amount, and the authors emphasized that benefits occurred when the meat was lean and unprocessed. Pause and ask, how can the same food appear harmful in one setting and neutral or helpful in another? Because foods travel with companions. Red meat eaten with fries, soda, white bread, excess salt, and no vegetables is one biological package. Lean red meat eaten with legumes, greens, whole grains, olive oil, fruit, low-fat dairy, and sodium control is another package entirely. More recently, a randomized crossover trial of Mediterranean-style diets with varying amounts of lean beef reported improvements in blood pressure and vascular function compared with an average American diet. That does not make beef a medication. It shows that food context can change the physiological outcome. Now translate this into a plate. Use this model. Half the plate, non-starchy vegetables. Make them colorful and generous. 1/4, beans, lentils, intact whole grains, or starchy vegetables such as sweet potato. 1/4, lean red meat, usually 3 ounces cooked. Add fruit, low-fat yogurt, nuts, seeds, herbs, vinegar, lemon, and olive oil. Remove processed meat, excess salt, creamy sauces, deep frying, sugary drinks, and oversized portions. Do not fry the meat. Grill, bake, roast, broil, or saute lightly. Do not char it heavily. Trim visible fat. Drain ground meat. Choose extra lean ground beef when possible. Use marinades without salt, vinegar, citrus, garlic, onion, pepper, cumin, coriander, rosemary, thyme. Let flavor come from plants and spices, not sodium. Why does this work in real life? Because it gives people a controlled path instead of a moral lecture. Many patients here never eat this again, and they mentally leave the room. Give them a precise method, and they may stay engaged. Tell them, if you want red meat, earn it with structure. Keep it lean, keep it small, keep it unsalted. Surround it with potassium-rich foods. Track your pressure. And yes, track your pressure. Do not rely on feelings. Hypertension is often silent. Use a validated home blood pressure monitor. Sit quietly for 5 minutes. Feet flat, back supported, arm at heart level. Measure twice. Record the numbers. Bring them to your clinician. How will you know whether your dietary strategy is working if you never measure the outcome? Also, do not stop prescribed medication because a meal plan improves. That is not discipline, that is risk. Work with your clinician. Food can be powerful, but hypertension can be dangerous even when you feel perfectly normal. Now let us address the main objection. Isn't red meat bad for the heart? Answer carefully. Fatty and processed meats are the major concern. Large portions are a concern. Low fiber, high sodium, high saturated fat meal patterns are a concern. But lean, unprocessed red meat in measured amounts inside DASH or Mediterranean-style eating has clinical trial evidence showing it can fit without destroying the blood pressure benefits of the pattern. That distinction is the entire message. The 2025 High Blood Pressure Guideline communication from the American College of Cardiology emphasizes heart-healthy eating such as DASH. Reduced sodium, high intake of vegetables, fruits, whole grains, legumes, nuts and seeds, low-fat or non-fat dairy, and inclusion of lean meats, poultry, fish, and non-tropical oils. So be precise. Do not say red meat treats hypertension. Say lean, unprocessed red meat can support hypertension management when it helps a person follow a DASH or Mediterranean-style pattern, replace processed salty foods, preserve protein quality, control appetite, and maintain a nutrient-dense plate. That sentence is the center of the talk. Let us close with practical commands. Choose lean, unprocessed red meat only. Keep the cooked portion close to 3 ounces most of the time. Use it as a protein accent, not the center of the universe. Replace processed meats first. Season without salt. Pair every serving with potassium-rich plants. Track your blood pressure. Stay consistent. Work with your healthcare professional, especially if you have kidney disease, diabetes, heart disease, or take blood pressure medicines. Why can this approach be beneficial? Because it respects physiology and human behavior at the same time. It lowers the sodium burden, supports protein adequacy, improves meal satisfaction, and helps people stay within a proven blood pressure lowering pattern. How can it be effective? By changing the whole meal environment, less processed food, less sodium, less saturated fat, more potassium, more fiber, better portion control, and better adherence. So do not fear the ingredient blindly and do not glorify it carelessly. Use it intelligently. In hypertension, the winning move is not extremism, it is controlled repetition. Thank you for being here with me today. Take care of your heart, take care of your table, and take care of one another. See you with the family in the next topic.